successive record on weekdays for boosters. So for the 8 weekdays since the increase in eligibility was announced, each day we've seen an increasing number of Australians coming forward to have their COVID-19 booster shots. 167,000 Australians stepped forward yesterday to have their boosters. All up, we're now at over 1.8 million Australians who've had their boosters. We're 500,000 boosters ahead of schedule compared with where we had hoped and expected to have been at this point in time. And that's a tribute to our vaccinators, to our commonwealth and state clinics, in particular our GPs and our pharmacists. Our pharmacists have gone from 15,000 a day just over 10 days ago up to 54,000 vaccinations a day. And we're supporting them with our additional funding, which commences as of today, to be able to provide that support through the Christmas and New Year period. They've worked hard and we want to support them. And I want to thank all of our vaccinators. At the national level, we're now at over 41.8 million vaccinations, with a total of all shots yesterday of 215,000 doses delivered, the highest since October. Of those 215,000, as I mentioned, 167,000 were boosters. So the booster program is 3/4 of the national vaccination program. National rates have now reached an extraordinary 94.1% of the over 16s and 90.9% double dosed amongst that age group. And so I want to thank everybody for their work. This is a real point of hope for Australians. They're coming forward for their vaccinations, they're coming forward for their boosters, and I'd encourage everybody to do that. We have heard that the states will be stepping up their effort. Through the course of the program, it's been 60% commonwealth and primary care, pharmacies and GPs, and 40% states. That has moved to being approximately 75% commonwealth and 25% states, and in some states it's down to 15%. So what we want to do is we're lifting the commonwealth effort, and to see those state numbers rise, and I welcome the announcement by Victoria today, for example, that they'll be stepping up their support. I think that's exactly what National Cabinet was aiming to achieve yesterday, and to see that response immediately, I think, is a very heartening sign, a very responsible sign, and a very welcome sign. Now, there are 2 other very important things that have occurred. We have had a bulk billing increase to 89.6% in the July to September quarter. So the last quarter is up 0.7% in terms of bulk billing. And what does bulk billing mean? It means that now almost 9 in 10 visits to the doctor are completely free for people. And that's a really extraordinary national achievement. Again, thank you to our GPs and our clinicians right across the country. This is approximately 7.9% higher than for the same period immediately prior to the coalition coming into government. So a nearly 8% increase in bulk billing over the life of the coalition. It just means more services, more people able to access the doctor without having to dip into their pocket. At the same time, I'm really pleased that we've just achieved the lowest change in private health insurance fees in 21 years, a 2.7% increase. We've had progressively the lowest change during my time in 16, 17, 18, 19, 20 and now 21 years. And so the lowest change in private health insurance in 21 years, that's good for families, that's good for private health insurance. And what we've seen as a result is 5 successive quarters of an increase in private health insurance uptake. It takes the pressure off the public hospitals. It shares the load across the system, and it means the Australian model of public and private, it's not as reliant on the public as the UK system. It's not as reliant on the private as the US system. It means the Australian model is not just being sustained, but it's strengthening. And with that, I'll just note that obviously the states and territories have begun to implement the measures discussed yesterday in National Cabinet. There are measures in relation to QR codes in New South Wales, in masks in some states and territories, in terms of vaccination clinics in Victoria. That's matched with the additional $10 for vaccinations by GPs and pharmacists under the Commonwealth system, which is being paid immediately as of today. So I want to thank all of those people for coming forward. So they're helping themselves, they're helping their friends, their family, and they're helping to protect the country. I'll